cases of infections have continued to rise despite measures put in place by government to curtail the spread. Some persons have continued to disregard the stay-at-home order by government. Recent cases of COVID-19 confirmed by the NCDC are persons who have no foreign travel history, indicating a dangerous curve. The NCDC says communal spread of the virus is on the rise. Director General of the NCDC, Chike Ihekwazu, says the only remedy is for people to stay at home, wash their hands regularly with soap and water, and to maintain social distance when they go out. Getting Nigerians to comply with these directives is the big challenge. Well, joining me via Skype is public health physician and CEO MEDWAY Health Limited, MEBAWONDU. Good morning. Thank you for joining us on TVC Breakfast.
Good morning.
Now, the government has some would say that the government has putting so much effort to ensure that the curve is flattened, so to speak. Yet we keep seeing a rise in cases of COVID-19, and concerns are even being raised with regards to a community spread. What do you think really is at the heart of this community spread that we are seeing coming up of recent?
Thank you. Essentially, we have not complied very well with all those measures to prevent community spread. Now, the cheapest and the simplest method for us to do is actually to maintain social distances, to obey the lockdown rules, and to keep our hygiene and sanitation at top notch. We have to re-emphasize and say this. Then secondly, at a point, the government was losing the narration, because normally we saw some influential individuals, we saw some pastors, we saw some other people coming out and actually, directing the narration to another level. Thirdly, even as now, because some of us expect the number of cases to also increase the more, because we are not testing enough. We are not testing. Look at Ghana. As at now, Ghana has tested close to 38,000 people, 38,000, and they have seen close to 600 positive cases. We are still at 5,000. And even at that 5,000, we have seen 323 cases, in about 19 states, plus Federal Capital Territory, making 20. So now we need to honestly firm up testing. The testing will tell us exactly the picture we are facing. Another obstacle to this, to the challenge we're having is the fact that quite a lot of people, apart from not observing the social distancing, there is a lot of issues concerning security. People are getting scared. There are a lot of unrest happening here and there. Lagos, for instance. So these are some of the factors that is driving the local transmission or the community transmission of the virus in the country.
Communities we find across Lagos, for instance, are communities where when you say social distance, having that, it's quite a challenge because you see people living in clusters, and it's more like living in a slum. How much of a challenge is that with all of this that you have said?
Don't forget, I mentioned earlier, in earlier interviews about weeks back, that if we're not careful, we're going to see the transmission, the germ, the coronavirus, jumping from slums. Now, in the slums, it's going to be a lot of challenge to ensure social distancing and sanitation and all these problems, all these things that will mitigate the number of cases that are coming out. How do you now assure that at these areas, you don't allow more cases to come out, you allow people to maintain the social distances? That means that you have to put focus on those slums. Now, the focus you're going to put there is to actually, get your people there, put boots on the ground, campaign in those areas, let people understand. Look at people where you can provide for some household the materials to do hand washing, basic soaps, and of course, and the bucket with water there in case they don't have, because a lot of them may not actually have water. find a way to move water into those neighborhoods so that they can supply them, to help them. And then thirdly, you have to deploy your palliative effectively in these areas. If you don't do those palliatives, if they don't have means of washing their hands, if you are not putting your boots on the ground to constantly alert and tell people the reason why this thing must happen, and then you don't also step up testing, make the testing easier in those slum areas, you are going to see, a serious rise in the number of cases and then with the aftermath effect. So it's important that the focus at this point now should be on those slums. It should be on those slums because after we have stopped importing coronavirus from abroad, the next challenge we're going to face is that should this virus enter the slum areas, it will be quite devastating.
You mentioned that increasing capacity of our testing, and some would say that we have seen some well-meaning Nigerians donate monies and all of that, and we also saw the Chinese man, Jack Ma, donate some of these materials to us. So what are we really waiting for? What is the challenge with regards to increasing capacity with regards to testing?
The challenge essentially will still be the test kits. That will be the challenge because let's face it, so many countries in the world, came forth and they also need those test kits. The same week US had its own first case was also the same week Korea had their own first case. But the response for Koreans was actually to ramp up testing and institute the social distancing and some lockdown measures. That's why you see now they were able to turn the curve. But, you saw America where those things were not being done. And they're still arguing what tests to do, whether to do tests or not. Now, if you look at us, our capacity to do testing is quite limited. For instance, in Lagos, we have just about 2 or 3 centers. The Lagos Biosecurity Center, NIMA, and LUTH. For me, that is too small for a population of 20 million. Now, if you want to push the testing up, you have to really be able to open up the test center. Even if you are not going to use rapid diagnostic test, you must be able to open the test center and allow people and make it so easy to get materials there, to get the specimen to the test center, and also for involving other medical doctors to say, okay, can you take specimen for us? Send the specimen, then we can test. Let's face it, the test kits are not sufficient. They're not sufficient. We're just managing with what we have. And then, where are we going to get supply? Except we have to look up to all our like WHO, possibly China, to supply us. And then it must be test kits that will be reliable, that will be sensitive, that will be specific.
All right, to you, MEBAWONDU, thank you for speaking with us on TVC Breakfast. Joining me via Skype is public health physician and CEO MEDWAY Health Limited, Tui MEBAWONDU. Good morning. Thank you for joining us on TVC Breakfast.
Good morning.
At this point that we find ourselves, how critical is it for people to ensure that social distance and curtail the community spread that would result to flattening the curve? And if that doesn't happen, paint us a picture of what the implications might be.
The implication is very dire. The next 10 days will be so critical to Nigeria. It will determine whether we'll be able to, negotiate the curve and then move to a point of reassurance. Let's face it, trying to open the country for now is a mirage. We cannot attempt to do that. Government must take hold of the information, and ensure that, people are fed the right information, they understand the right perspective, and then be able to adhere to this next period for us to be able to negotiate the corner. Now, if we lose information as it is now, and people don't then believe, because we're having so many toxic messages on WhatsApp and social media trying to pollute the narratives that's been churned out by the Nigeria Center for Disease Control. So we must go back and take charge of the information. It's very, very key. Even at that, apart from taking charge of the information, it is also very important that we have to look at the incentives that will keep people at home, maintain social distances, and push hygiene further. Any investment we spend on this will not be wasted at all. We need to actually look at those areas very critically, because we cannot, you cannot allow social unrest to brew from any of the areas or any of the slums or any of our cities because of this, because of the lockdown. So, if we don't keep to this simple, cheap, and reasonable checks to enable us, beat the virus, there's no place for us. There's nowhere we can get human resources. There's nowhere we can get money to run the aftermath should the virus break into society fully.
Now, you've been speaking about communication and ensuring that we take charge of the information being spread out there. Now, if we are to do that, how critical is the aspect of community communicators, using them at this point to really drive home this message that needs to get out there to the communities and ensure that we limit the spread community-wise?
The information dissemination must be as local as possible in the language and the manner people can understand it. Let's look at, for instance, because when we're talking about community, it's not just about a rural village hanging somewhere alone. It has to do with your religious inclination, your social groups, the market associations. We must use all these things because, for instance, I had expected that the government would have drawn in a lot of religious leaders, both Muslims and Christians and traditional leadership too, and instruct them clearly. These are the kind of communication we want to come at. Help us. If it means deploying some support to them to enable them communicate, because they exert so much influence on the people. If we get the communication right at those levels, and we can be able to win the support of the religious leader into proper communication, that will be a huge mileage. The second level of our action should be even at the level of the traditional institutions. We must, because these people exert a lot of influence at their local level, we ought to have brought them in. It's not even too late. We have to bring them in as much as possible to tell the people in there as local as possible what they need to do and why they must adhere to those three tripods of social distancing, hand washing, and the lockdown. We must bring them in. Then if we want to push the incentive must flow along that line. We must be able to build that into the incentive to so that if your community observe this, this is what the government can also do. Now, this is a point, at post-COVID, even from right now, this is the time for government to sign a new contract with the people. It's important that the government must sign a new social contract with the people to reduce unemployment, to push housing, to ensure that 24% unemployment we're witnessing in the country is reversed. If we don't do that, we're heading for a social upheaval post-COVID-19. It's a serious issue that we need to put our feet down and do a proper thinking. But where we are now, the government needs to reassert itself and get hold of information control. Yes, there's technology there for us to use to further support this campaign and ensure that people stay at home. But without proper social support, without proper palliative being deployed, this thing will be a mirage.
Now, earlier you mentioned about getting to the point of reassurance. What would it take for us to get to that point? And what would be the indices for us to know that we have actually gotten to that point of reassurance?
Now, first and foremost, for us, we're looking at the testing. For instance, Lagos, 20 million people. We're looking at least a testing for at least 1 to 2% of the population at the critical point. Now, we need to take that test up. When we take the test up and we see that picture, the figures, then we can start understanding exactly. It is nice that we're bringing out the positive aspect of our own care. I mean, the number of people being discharged, the death number is still low, but we need to show people that quite a lot of people have been tested. We need to localize the testing as much as possible. That is for sure. Then, if we're able to break, or slow down, because what we're doing now is to slow down the community transmission. If we can slow down the community transmission sufficiently, we can then move to a point where we're going to break the transmission. Of course, this one is not going to happen in the next 3-4 months. Let's forget it. We have a long haul. It's a long distance journey we are on. and we must be ready to cooperate and endure this. One of the few things that can help us endure it is the level of stimulus that will come out after this COVID. Even right now, it should come out, because if it's not ambitious, if it's not bold, it's going to be a big problem to stimulate and ensure that people cooperate with you in fighting this virus. Then let's face it. Another thing is that if we are not able to deal with our own, it will be a problem even for the rest of the world to interact with us. You may have to have a COVID-free certificate for you to enter some other countries in the world in future if you don't do our own.
To you, MEBAWONDU, we'll leave the discussion at this point. Thank you for speaking with us. Joining me via Skype is public health physician and CEO, MEDWAY Health Limited, Tui MEBAWONDU. Thank you for joining us on TVC Breakfast. Now, let's talk solutions now. How should government go about addressing this strategically such that the curve will be flattened as much as possible?
First, communication, communication, communication. We can't overemphasize this. We need to communicate. In fact, this present combative style of communication must be changed. You know, the communication must be relevant, must be focused, and must go to the places where we're having the likely greatest outbreak of this COVID-19. And I've mentioned the slums. Secondly, if you want people to stay at home, if you want them to maintain social distancing, if you want them to wash their hands and keep the sanitation as much as you want, then you must be provision of food, medicine, and bare necessities, especially at these areas where we know that the outbreak will be so bad and so disastrous for us, and in densely populated communities. Now, I also think that the government needs to really sit up and roll out rapid tests. You know, you see, when we talk about testing, the testing will give us a clearer picture of what we're dealing with. You know, without testing, we'll deal on a lot of assumptions. Assumptions will not help us at this point. We must know where we are. And one of the easiest way for us to know where we are is to ramp up our testing. We may not be able to have moved this PCR, which is more expensive. But again, if you have a rapid diagnostic test that can help us be able to know whether you have or you don't have, it is going to help us. Now, this is key. We must be able to do that because, number one, look at the ICU bed we have in this country. We have barely less than 1 per 1 million person of ICU bed. If you have just about 200 ICU beds in the whole of Nigeria, where then are you going to get ways or places to treat people with the complication of this disease? We must be able to embrace all this if we want a change. Beyond that, the health system needs to be revamped and changed because coming out of this coronavirus, we're going to see a lot of depression, a lot of mental health challenges. Suicide is going to be on the rise. You know, poverty will increase, malnutrition will be there. We need to get prepared for all these things. But what is cheapest for us right now is to push for communication in easiest way people can understand. We need to embrace all the stakeholders. The stakeholder is not just thinking about government communicating. Where is the power structure in every community? Is it the local people? Is it the priest? Is it the imam? Is it the church leader? We need to engage them. You understand? You need to honestly engage them. Because if you don't engage them in the communication will fail. Because to a large extent, we have seen gaps in believability of government. People don't tend to believe government so much. But they can rely on their traditional religion, they can rely on their pastors. Use them, please, to push this communication.
Now, how can we bring in technology to also address this? We see in other countries, they are adopting technology, developing apps that could help locate persons who might have moved to one community or the other who might have the virus but may be asymptomatic. And also we see some other organizations coming up with wristwatches that could also detect patients who have the virus. How do we adopt measures using technology to address this as well?
It is important that we need to really explore the use of social media to drive our messages. We need to use it as much as possible. That's another cheaper means of dealing with this. Now, we have so much funny messages circulating on the WhatsApp media, for instance. But how many of these are original to us? I am yet to hear some of these our challenges, some of these communications or education in even the native languages. You know, we sit down as we're at home now, we're watching a lot of films, videos, and African magic and all that. How much of this are we saying on those media? So it is important that the social media, we can use the text messages, the emojis, the skits, these short skits that can be used to patch this message. We must, as much as possible, incorporate it to our, even every comedy strip that we make, we must incorporate it. We must really honestly find a way to communicate this thing appropriately. Now, the social media that's appropriate to us, the technology that's appropriate to us, we must use it as much as possible. If we don't communicate, the other options are too expensive. Now, we've seen situations whereby people have to be put on tag and be monitored and you know, to check how well this thing is, they're complying with social distancing. But if you need to do that, you must incentivize people to be part of that participation. You know, if you don't incentivize them, they will walk away. Because honestly, this is a time for government to build trust. The government must be able to build trust. Coming out of this coronavirus, COVID-19 disease, government must be able to roll out a big stimulus. We must be able to sign a new social contract with the people so that they can have money to put in their pocket and spend, because the economic implication after Corona is going to be quite challenging.
All right.
Then again, we must support industry firmly. We must support industry firmly, and of course, we must reform our health system. Without all these things, honestly, we're in trouble.
Dr. MEBAWONDU, thank you for speaking with us.